that I was public health nurse. So actually, yes, is I will still in Illinois. We're still doing the home visits. So right now we're not doing the home visits, but we will do the public educations. So one of them, of course, is I have the cloth, which is the mask, and I do have the N95, and I do have this gadget to protect my eyes. So those are the things, and of course, I put this alcohol gel outside the house before the kids or touch my doorbell. And of course, I have this to wash them for the surfaces for contact points. So those are the things that we could do. Um, Things that we could do to prevent infections. So at this point, uh, the COVID-19 is really affecting to each one of us. So make sure that we're basically doing our best in participating to preventing all this spread of virus. So that's all I have to say for now. Thank you.
Wonderful. Thank you so much, Brian. It was again I was very much amazed at your enthusiasm, of course, your charisma, and of course, your heroism and the activism that you do with our community. So thank you so much for all you do, Brian. Um,
Thank you.
I also, we did include, and I'll share our screen now so that everyone can see what's on our digital resource, but we also did include some of the community health resources that we can share with the public. Can you tell us a little bit, Brian, about what maybe these four or few links may be for?
So the IDPH community guidance is basically it will give us hour to hour or on the point what should we do to guidance to our restaurants, to our social, to the churches and everything that we do. And of course, my domain before I retired is on 0 to 18 years and I was zooming in into childcare. So those are the referrals. The INCRA is Illinois Child Care Referral Agency for all the childcare that all the kids that in the school system that they can have resources with. So the Chicago Health Alert Network is basically based on Chicago that we are going to be paged if there are outbreak um, or anything that they have to put it out to make sure that we're alerted. And of course, the Philippine Nurses Association, Illinois, is basically we are updated every now and then to make sure that we are actually updated to all this pandemic.
That's fantastic. Thank you so much again, Brian, for sharing with us your experience and in some ways giving us good hope that we have maybe experienced this all in the past. We have found ways to treat it and people have recovered. And I know for a little bit we were talking about maybe it has something to do with the mobility rate and even the way that information is much more quickly spreading. Um, so thank you for
No problem. The only thing too is that there are impacted things that we do. The mental health side of this pandemic is so much that and addressed off. So there's a lot of things that we could do as to prevent like one of these social connections that we have is basically of course exercise every day to make sure that we are preventing the mental side of another wave of pandemic. So this is pandemic within the pandemic.
yes. Yes, thank you. Thank you again for all your great advice and for all the wonderful information. I would like to next introduce someone who you actually invited to our chat. And this is Miss Lila Bush, who will speak next. I want us to maybe jump to you, Tita Lila, if this is okay. Um, would you be all right if we introduce you
Fine.
next?
That's fine.
Thank you
You
so
just kind
much.
of startled me. Like
I'm
I
so
thought I was
sorry.
number three.
I know. I think we've got Terrence who is just coming from a shift actually. So I
Okay.
want to make sure that we give him some time to be ready. So if you don't mind just jumping in, our next speaker is Miss Bush, who's a licensed nurse, and she's also representing the Philippine Nurses Association. So, thank you so much again for being with us. And if you want to maybe speak a little bit, should I go straight to the slides that you have prepared?
That's fine. You
Okay,
could just go ahead and jump onto my slides.
thank you so much. Um,
All right. So I am here from Kansas City, and I am actually retired, so I don't have a direct patient care, but my involvement is with the Philippine Nurses Association, being the regional vice president. The PNA has 55 chapters, and North Central region is one of them, and we have like 500 members. You could see there, we are mostly from the Midwest, and PNA Illinois is one of them. Um, so my role there is coming from the COVID initiative that we started right at the start of the pandemic. And the next slide, please. So the COVID-19 task force was created to assess the impact of the pandemic and initiate fundraising campaign to support the critical, intermediate, and long-term interventions and programs that will benefit our nurses and the community and the overall healthcare delivery system in the long haul. So we made our recommendations. The priority was at that time master nurses and care package drive. Since we have about 500 members, each one of us receive two cloth three-ply mask. And then, depending on the chapter, we also started some care packages, the frontline workers. And we are actually on the intermediate phase right now, which is heal our nurses, which we do by supporting them. We fund to provide telesupport in memoriam and frontline videos. We also do narratives of our frontline experiences. We submit it to the Inside PNAA. That's our national newsletter. And so it's just like we express our desperation, inspiration, loss, and anguish, coping and healing, family struggles with social isolation, creativity, hope in times of crisis. And we also created a platform to highlight relevant works and contributions to the community and use this as a mechanism for our nurses to share our stories at their chapter, national, and regional levels. Next slide, please. Ginger. Okay, so our intermediate goal and long-term goal, which we are also in the present phase, is the resilience program. And you all know that resilience offers hope to us in our personal profession professional lives as we continuously increase um, our protective factors and adjust to our daily activities. And we are offering educational programs as well as public awareness campaign. We explore long-term impact of burnout, post-traumatic stress disorder, and policies that can improve health and supply chain and access during disaster and the pandemic. We also have partnerships through grants that will fund the forums, educational sessions, research initiatives to address and improve PPE design, supply chain distribution, resilience in the community, xenophobia, which we all know exists, and discrimination as well as health equity, access, and global health. Next slide, please. The task force next steps would be governance and call to action. So we plan and execute. There are regional and chapters task force, and like I said, the mask for our nurses, which will be done by the community outreach, the regional vice presidents, the COPRR, which is a circle of presidents, regional representatives, and the chapter presidents. Then for our Heal Our Nurses programs, it includes the advanced practice nurses, research, education, legislation, communications, and marketing. The fundraising is being taken care of by the Ways and Means, Communication, and Marketing, as well as the website. We also monitor the task force distribution of mask and completion, psychosocial support programs, education and support programs, policy and community collaboration, as well as the fundraising progress. Next, please. How can we heal our nurses now and for the long haul? Again, we have fundraising goal for each of our nurses project per category, and it's a lofty goals. We have nurse champion category, and that we aim to raise $50,000 and $50,000 again for the educational programs. The $50,000 goes for narratives for resilience, nurse resilience programs, and it could be individual or corporate donors. And then we aim also for corporate sponsorship as well as individual champions. And to do that, you could just log on to our website, is mypnaa.org. Thank you very much.
Thank you so much, uh, Tita Lila. I'm so happy to have met you. um,
Same here,
for
Ginger.
this. And again, I think it's just so important that our community knows about ways that we can support those that are always there to support us also. So we'll be sure to include this, have this with our digital resources so that our community can come back and look at the presentation that you just delivered. So thank you so much for joining us and for being with us here today. Um, I understand now here in Chicago, Governor Pritzker and the Illinois Department of Public Health has just announced a COVID-19 resurgence. How is it there for you, Tita? I know you're calling in from, did you say Kansas?
Kansas City, Missouri.
In Missouri.
Yeah, like everything else, every place else in the Midwest, we're on the upcharge.
Mm,
So we are very careful. I, for one, I don't go out as much,
that's
not
right.
anymore.
Yes.
And I always, when we have meetings, we incorporate healing as well as reporting on how our chapter is doing. We have a monthly circle of presidents meeting, and
Okay.
that's when we have a template on what we report on, like how many deaths, what are we doing for our community.
Mm,
So every first Wednesday of the month, we have a circle of presidents meeting for the North Central region.
I see.
So that's our way of coping up as well as sharing our experiences and what is
Yes.
going on
I
with our region.
Yes, I think that's so important to be part of having the group and being able to come together during these times. Thank you so
Yes.
much again for sharing.
You're quite welcome. And in behalf of the Philippine Nurses Association of America, thank you for giving me this chance to be with you all.
Yes, thank you. All right. Our next guest panelist is ready. He is home safe. And so I would love to introduce to you Nurse Terrence Yee, who is a member of the bargaining committee for the INA UIH local. So congratulations, Terrence, and thank you for all of the hard work and commitment that you and many others championed during the summer. If you can tell us a little bit about you and your history and the activism that went behind um, the uh, demands of the nurses during the start of this pandemic. Welcome, Terrence.
Thank you very much, Ginger. So I've been with UFI since 2004. I've been a nurse since 1992. I just became active with the INA, which basically is a union for UIH, beginning in 2011. I've been the treasurer for the local. I became the president of the whole state from 2015 until this past August. It was pretty slow at the beginning until we hit the pandemic. When the pandemic hit Chicago, the INA of UIH demanded that we do daily meetings with the management as to handle the nursing duties in terms of managing the COVID. So at the beginning, we asked for daily masking, but we were refused until on March 27th, we went to the media. And in that afternoon itself, they were not planning to do a universal masking for the whole hospital until they saw us in the media that they changed their mind and basically did a universal masking for the whole hospital. The good effect about that one is that I've heard other nurses from other hospitals implemented that after they saw the media coverage that we've had from UIH asking for the universal masking. We continued that all throughout until the end of June, and when they undeclared the external disaster. Unfortunately, even with those things that we asked for in our daily meeting with the management, we lost two nurses in our hospital. One of which is a coworker of mine. I've known her very well for the length of time that she's been in UIH. Her name is Joyce Pacubas LeBlanc. She's a Filipina. She worked in U of I for 10 years. And it was so sudden. We were just working one day, and then all of a sudden, we didn't see her because she was on sick leave. And the next thing I know is that I got a text that she's in the ICU. Few hours later, I get another text from our group that she passed away. It was very sad. It was very hard for our unit to experience that loss that we've had from our coworker from this virus. Um, Up to now, we still feel that loss. We even kept her locker as empty, not actually empty, because she's like the mother of our unit. So she provides us with anything that we want, like extra pen or pills or anything. So we memorialize her with that locker with a picture in it. And if we have any extra Tylenol or ibuprofen, we keep it in there. And then if we need one, we know where to go. We go to Joyce's locker, and that's how we memorialize her. In terms of the union, so from that pandemic episode that we had, once we're done with the daily meetings, we went straight for our negotiation scores. We were up for our negotiations for every 3 years. Because of that loss, it empowered all our nurses. Because of the mismanaging also of the way the pandemic was handled in our hospital. So because of that, the all nurses were empowered with that. They were giving us a hard time because we were asking for, as I believe Brian mentioned about disaster preparedness. We wanted to have disaster preparedness on our contract, and they denied that. We wanted to have better equipments in our hospital. They denied that. So that's why, and we want better staffing also. We wanted ratio. So that's why we went all the way to a strike vote and went for a strike starting on September 12th, and it lasted for a week. During those times, we were negotiating very hard about that one. And in the end, after the strike was done and over with, within a week, we got a contract, and we got the two biggest things that we got out of that was we got the disaster preparedness, which we have the N95, which we are asking now for a universal N95 masking, and not just a regular surgical masking, but universal N95 masking. So we got that in our contract. They have to maintain the amount of the number of N95 around the clock every 3 months. They have to be ready and then they're required to meet with us if the disaster is going to be declared again within the hospital. The peppers, the HEPA filters, we got those in the contract also. The second biggest thing that we got from our contract is better staffing. We might not have gotten a straight up ratio, but what we did was we decreased the threshold for the acuity, thereby lessening the burden of the nurses. And because we decreased the threshold for the acuity, we were able to get from the management to hire 160 FTEs. So That's equivalent to a full-time 160 nurses to be added into our workforce so that our nurses are not going to be so burdened. Um, so those are the things that we have, and I believe, and I've been telling a lot of my co-workers and a lot of my co-members in the union, every hospital should be unionized, and we are a great example of that one. It's because of our union, which is the Illinois Nurses Association, we were able to achieve that. We were the very first one, I believe, in the whole in the I know in the state we were the first one, but we were one of the first in the whole U.S. to get a hazard pay, and that is very important because we are putting our lives in the line. As what you could see, we have 2 deaths in our hospital alone, much more in other hospitals too. So I believe, as we are talking about activism, nurses should be active in voicing our concerns and how we should be practicing, and we could only achieve that if we have union in every hospitals. And that's all I got to say.
That's so fantastic. Thank you so much again, Terrence, for giving us the history. Again, we admire and, just are so very grateful for you and everyone's ability to just kind of champion and give voice. Last week, we had a talk around ethnic studies, and I believe one of the takeaways was that the struggle continues. So, do you agree with this statement, Terrence?
Oh yes, the struggle continues even up to now. And now, with what you guys mentioned, there's a resurgence, right? We just had 8 nurses positive for COVID in our sister unit, and I just have 2 nurses that I know in our unit got positive because of this transmission. So the struggle within our workforce, not just fighting the virus, continues because even with the union in itself, there's still a lot of discrepancies in terms of how we practice, and that's where the problem lies.
See.
If we just um, follow the rules and regulations, the policies, then we don't need a union. But there's always those violations. So
Yes.
the union is there to protect us.
Wonderful. All right. Well, we are in good time. Tito Ruben, I think we did very well this time around. We had 3 wonderful guest speakers. We spoke uh, around heroism and activism and got to hear from our frontliners, our essential workers, and we thank them for being here. So this is everyone. We're gonna take a nice, good group shot together, and I can also um, make sure that we share the recording of this. Of course, you can find these on our Facebook pages as well. Any closing words, Tito Ruben, for our special guests?
Oh, again, I would like to thank all of you, Brian, Lila, Terrence, and of course, Ginger, for all the work that you've been doing. As Terrence had said, the struggle continues.
That's
I mean, we are still in this pandemic. And so let's follow the guidelines in making sure that we wash our hands, wear our masks, and of course, social distancing. So maraming salamat and happy Filipino American History Month. We're glad that you're able to share a lot of information today. As you all know, we're celebrating the history of Filipino American activism. And this 2020, you are our heroes because it is you who have been doing the active work during these times. Maraming salamat.
maraming salamat.
Thank you. Thank you.
Thank you so much. Circa Pintig is
Thank you.
committed to continuing to share your stories as well. So please look out for possible future invitations. And we hope that you'll continue to keep the communication and the conversation going. We're happy to support you and all of the wonderful work you do. Thank you.
Thank you.
Thank you. Thank
Thank you.
you.
Take
Thank you.
Take
care,
care, guys.
Take
Take
everyone.
care.
care. Take
Bye
Bye.
care.
bye.
Bye
Bye.
bye.
Thank you.